Hi, I'm Dr. Jason Pozner, and this is the Plastic Surgery Channel. I'm here talking to you today about the Lutronic INFINI device. It's one of my coolest, latest, greatest devices that I've been using in my practice. My favorite procedure in the world for acne scarring is microneedling with energy. So this is fractional radio frequency with energy. This is Lutronic INFINI. So these class of devices have really blown up in the last year and have become very popular. They are a skin tightening, smoothing device and our go-to device for acne scarring. Basically what we're going to do today is we're going to first block him with some local anesthetic because we're going to go pretty deep with this. We're going to then treat the acne scarring with microneedles, these small 34 gauge needles that have an exposed tip, and that exposed tip is going to put down a radio frequency energy into different layers of the skin. And over the next few months, he'll see improvement in his acne scarring. The depth of penetration into the skin is variable from 0.1 to 3.5 millimeters. So we use different depths depending on what we're treating in the skin. So with this, the intensity of the treatment is adjustable, as is the time that the radio frequency energy is off. I'm going to set the needles at 3 millimeters to start because this is really thicker acne scarring. We'll start with that. All I do is hit standby. It's going to tell me to go. And this is a really easy procedure to do. So basically there's no recovery with this device. He'll walk out of here a drop red. He'll probably be red for an hour or two. But by tonight he's fine, maybe a drop red tomorrow. I consider this a no downtime procedure. This is actually my preferred device now for tightening of the face. We're using it on younger women for tightening, acne scarring. Doesn't replace a facelift, but in a younger patient, it's my go-to for tightening. And I've treated faces, I've treated arms, I've treated breasts, abdomen, and legs with this machine. Most patients are treated 3 times. A typical procedure takes about 15 minutes or so. We normally charge about $1,000 per treatment, so it's a pretty good ROI for the doc and the patient. It takes a few months to see final results, and generally patients are treated at 1-month intervals. Last pass. I don't care what his skin type is, I would do this on all skin types. I mean, if I had acne scarring, I couldn't think of a better treatment for acne scarring than this. And these microneedles went in, he'll be red, as I said, for about an hour, but he's up and around in no time. I see this device as an Ulthera competitor, but you're getting the added benefit of the microneedles going into the skin. If you use it superficially, you can get some epidermal injury if that's what you want to do. As we go to deeper depths, which is what I generally do, you see no epidermal injury at all. Downtime is just generally a few hours. They look good the next day. They might be a little swollen if you do an aggressive treatment, but in general, it's a 1-day recovery period. We often combine it with other procedures such as IPL, Cyton Halo, or other CO2 fractional devices. So it's a very useful device in your practice.